The most popular, the most consistent, the most glaring recommendation from your labor and delivery nurses that thousands of nurses wrote in and recommended. Hey everyone, my name's Sarah Lavonne and welcome back to my YouTube channel. If you didn't know, we not only provide education here at Childbirth for families, but we also train labor and delivery nurses that will be helping support you while you give birth in the hospital. And so we have a flourishing community of labor and delivery nurses over on Instagram and on our website and in our community of Childbirth nurses. But on Instagram, I polled them and I asked them, what are the things that you want your patients to know prior to coming to the hospital? So that was my prompt, and I got thousands of responses, and there were three very clear leaders in the top three things that your nurses want you to know. And so I'm gonna start with number three. I'm gonna work into number one. The first one was by far the most glaring thing on the planet and something that actually surprised me. I would not have come up with this as number one, but it was across the board the most popular thing that your L&D nurses want you to know. Starting with number three. So I've summarized them, but I'm also gonna read you word for word what they said to you. And so it sort of is a combo deal, and I pieced like various responses together into one concept because I think the concept is the same sort of idea from all of them. And so number three is that they want you to know your rights, know how to advocate for them, and therefore take a childbirth class. So all of the things that were like, know and understand this, learn this ahead of time, take a childbirth class, know how to advocate for yourself, know your rights, say no. Those kind of things I kind of bunched together because that especially, which makes me like so excited and like lose my mind because this is the entire mission of why I started Childbirth was with the idea to change the game in obstetrics so that you have choices, that you don't feel like you're on a conveyor belt in a hospital birth, that you have a positive hospital birth experience. And so what I love about the movement that's happening in labor and delivery, thanks to the various programs that we have for them, which we'll link down below if you're curious what we do for nurses. I have like an entire team. I have like other educators. It's like blown up over the last few years. The best news for you is that you get these nurses that get to take care of you when you give birth. And so when you hear some of these responses, I want you to picture that these potentially are your nurses. Ask for a Childbirth nurse. Some of your hospitals might be like, what the heck is that? And if they don't know what that is, they're behind the game because they need to get on board and understand what a Childbirth nurse is. And some of your hospitals might be like, oh yeah, we've trained all of our nurses through my physiologic birth class or through our other programs here at Childbirth. And so that to me is so exciting because we're all gonna be speaking the same language. And so a lot of the things too that I'll read to you are the same kind of concept that we want you and I want you. That's the whole reason why I'm here and why I have so many classes and all of that is that we need to be speaking the same language. We need to be on the same page. It's not realistic for you to show up to the hospital and it be the first time that you're hearing about some of this stuff. Your experience will not be as good when you don't know because there's way too much going on. The stakes are way too high. You're actually having to make the decisions in the moment about what you want, what you don't want. You're weighing risk, benefits, alternatives, whereas you can do all of that ahead of time. That's something you can pick up and control. And so let me read you some of the things along those lines directly from your Childbirth nurses community that they want you to know related to this particular topic, advocacy, and taking a childbirth class. First one is take a childbirth class. There was a lot of like, just take a childbirth class. Understand what you need to know ahead of time. J. Cat says how to say no to the interventions they're uncomfortable with and how to ask for more education. I teach all of this in the Childbirth class. Literally, this class is like my soul to you on how to advocate for yourself and understand the medical system and hospital birth and all that. So take my class. But regardless, they want you to take a class. And of course, I'm gonna recommend ours. Kirit Graywall says a long list of patient rights, including the right to make an informed decision. Not decisions out of fear, not decisions because someone told you so. We want you, and it is our job as a labor and delivery nurse, which is one of the things that I am, to make an informed decision. So that means you understand what's going on. You understand what you're saying yes or no to, and you're not just saying no or yes because you're scared, right? That's going to lead to a worse birth memory. The number one is just like everywhere. I can't get past it. It's just like, I'm like, I get it. We get it. I'll tell you in just a second. Just a basic what to expect or what is labor. Take a childbirth class, baby meds, and decide on with their partner before coming, Hep B, vitamin K, and erythromycin. Understand that beforehand. You learned that in my childbirth class. That you have options for pain management. That's what you learn in a childbirth class. How to advocate for yourself. Also, you can say no to your doctor. Take a childbirth class. Coping strategies for pain, which you learn in my coping with labor class. Take a childbirth class. Oh, this is a good one. This goes along those lines too. Iravesa says that they can just do stuff. They don't have to give permission, meaning the nurse doesn't have to give permission. And when you know and you understand going into your labor and birth what you can do, which is pretty much everything, just do it. It's your body, it's your experience, but you have to have that solid foundation of knowledge in order to really feel confident to do whatever you want to do. All right, number 2, okay? This one I'm like scrolling through as well. I also summarized for you based on what I had read and like just sort of like globbing them together and trying to figure out like, okay, what's the common theme? And that common theme is that your nurses want to help you. They are on your team and they care about your safety, but they also care that you get the experience that you want for your labor and birth. I love that this was so common. I feel like if you gave birth many, many years ago, you may not have experienced this culture shift in nursing, but the idea is that your nurses want you to know that they are on your team, that they actually care about you. There is not any nurse that I know that got into the nursing profession of labor and delivery because they hate humans, because they want to harm people, because they want you to have the worst day of your life. Okay? And a lot of times that based on the stories you've heard or the vlogs you've watched, that a lot of times you come into the hospital making assumptions about others. This is like a life skill, right? That we make assumptions about each other all the time. We make assumptions as labor and delivery nurses about our patients. And so one of our mottos here at Bundle Birth is don't write their story. And so what I'm gonna ask you to do is not write your nurse's story, that when you walk into the hospital, assume that they are on your team. Welcome them on your team. I tell the story all the time of being in the hospital and the family comes in and I'm like, let's go. Like, I'm ready. What do you want? Let me help shape your experience and contribute my knowledge and expertise and help you get everything that you want that we can do safely. And all of a sudden, within seconds, I would know that I am the enemy, that I am not welcome there, that they want none of that, that they're gonna do it on their own and like do the bare minimum and then get out of the room. Which, if that's what you want, that's fully your decision, but ultimately you're missing out on their knowledge and their expertise and the love that they can pour into that room and that protection, that advocacy that you have as a resource from your nurses. And so my tip for you is give them the benefit of the doubt. Understand that they are on your team, that they want what you want, and for the most part. Now, of course, are there bad apples? Yeah, of course. And if you are not vibing with your nurse, then like you're not vibing with your nurse, and you can always switch nurses, even if that's not working. But ultimately, you really have this like wealth and this community of Bundle Birth nurses surrounding you that want to give their best to keep you safe and help you get the experience that you want. So some of the things that they said related to this topic are, Sammy says that we're on their team. We want to support their birth plan just as much as they want us to. Nurses actually want to help keep you and your baby safe and give you the birth that you want. I love that. Truly the best. I love this one. That we can't wait to be a part of the most important day of their lives. Okay? And so remember that like they care, they're trying, and it may be another day of work for them. It's not gonna be the most important day of their life, okay? But it's gonna be one of the most important days of yours, and they know that. And so while, they might be distracted or it might not go perfectly, these are human beings in front of you that actually do care. Give them the benefit of the doubt. And then, drum roll please, the number one thing that across the board was the most popular, the most consistent, the most glaring recommendation from your labor and delivery nurses that thousands of nurses wrote in and recommended I'm like scrolling and scrolling and scrolling and scrolling and scrolling, okay? So I'm gonna try to catch some in a second. Is sort of twofold, but the number one thing they want you to know is that inductions take a long time, okay? Which is like very random for a number one, but clearly we are not communicating this in the world of birth. Clearly your classes are not being clear enough about this. Clearly there's not enough education about inductions. Now, inductions in the United States are very, very popular, and they have grown in popularity. It feels weird to say popularity because like, are they popular or are they just common? They've grown in being more and more common, more and more frequently used in the United States over the last few years. Probably it's since the Arrive trial. I have a video on that. We have podcasts on that. It's a whole thing, okay? And so one of the things that somebody said, and this is actually a midwife that said this, and she said that spontaneous labor is better than the Arrive trial. So if you don't know what the Arrive trial is, you probably should know. I'll link that YouTube video down below. Basically, it's saying that an elective induction is better than waiting for labor. And spontaneous labor is when labor happens on its own. It happens spontaneously on the fly whenever it happens. And so this is a midwife making that recommendation. Obviously, this is her professional recommendation. I don't fully disagree, but I think it's much more nuanced, and that like to make a blanket statement about inductions or about anything in labor and birth, or technically life, is probably not the most wise in the world. But the idea is that they've become more and more popular over time. And so there's two types of inductions. And so the recommendation related to this is, yes, they take a long time, which I'm gonna talk about, but also they wanted you to know across the board what it entails to have an induction. And so this goes back to tip number 3, which is take a childbirth class. I talk at length in the childbirth class about that. I also do have a couple YouTube videos on that. We'll link everything down below. But you do need to understand, are you having an elective induction or is this a medical induction? There's a huge difference. A medical induction says your doctor or midwife says it is safer for you to not be pregnant anymore than to continue waiting for labor, okay? That this is a safety issue. Versus an elective induction means that you are electing. They may say your baby's big, I'm recommending an elective induction, or I'm recommending an induction because your baby's big. Your baby being big is not a medical indication for an induction. It's sort of a subjective, loosely subjective thing. And so you need to ask your provider if they're recommending an induction, is this considered a medical induction or an elective induction? And if it's an elective, it is fully your choice. So this goes back to number 3, again, that you have to know how to advocate for yourself. You have to know what questions to ask. And so if it's elective, you have full choice and you can say, no, that's not the experience I want. Or yeah, heck yeah, get me unpregnant in like a hot second. I'm done with this. Let's get over this. We're moving on, okay? And that's fully your choice. There's not one that's better or worse. It's just different. And each decision is yours to make. And so I'm gonna read you some of this, but then we need to understand, for instance, Caitlin says induction methods. So understand induction methods and birth preferences and the risk on interventions or not interventions, right? This sort of goes back to number 3 again. You have to know risk benefits of everything, but particularly she pointed out inductions. Kel says how long an induction can take. Corkscrew and Plot says your induction might take days, and that's okay. So let's set some realistic expectations for how long a normal induction can take. If it's your first baby, and let's say it depends on your cervix. So let's say your cervix is fully closed, do not expect that you are having a baby at least a day later, okay? So at least 24 hours. If you give birth with an induction in less than 24 hours, hallelujah, yes, let's do it, whoop-de-doo. Bragging rights, that's awesome for you, but that is not a normal expectation. For a first-time parent, it is extremely normal for your induction to be 1 to 3 days on average. So I always expect at least 1 to 3 days, but I've seen inductions, and I know all these nurses have as well. They've seen them go 3, 4, 5, 6 days. The longest induction I've ever seen is a 6-day induction. And that, you imagine, by the end, you're like tapped out. You're over it. You're like, why is this taking so long? Now, a 6-day induction is an extreme. That's a long time. But a 3-day induction is still normal because you're doing all of early labor, everything that you normally would have done for at least a day at home in spontaneous labor in the hospital. And so in order to get you into labor, it can take at least a day. So if you commit to an induction, commit to it for the long haul, all right? Gabrielle says inductions can take 3 to 4 days, and that is normal. And epidurals don't mean pain. I'm gonna give you all the other little side note things that maybe weren't quite as popular in part 2. So stay tuned for part 2. There is a part 2 coming. But these were most definitely the things that I'm like, and induction, understand an induction, what an induction truly entails, how long inductions take, all exclamation points. Especially for primes, which means first baby, and inductions of labor. Labor is a marathon, not a sprint. What an elective induction really looks like, especially for an unripe prime, which is nurse lingo for an unripe, means your cervix is super closed. Prime means it's your first vaginal birth or labor. That inductions, especially for first babies, are a process and can take a long time. What to expect with an induction, especially electives, primes, closed thick, high, closed cervix. They're saying the same thing over and over and over again. Scheduled inductions aren't a guaranteed appointment slot. Delays can cause stress on you, but that's sort of how it goes. So that's a little side note. How long you think your induction will be, double it. Someone says that G1P0, meaning first baby inductions, can take a long time. What to expect for the process of inductions, how long it takes. Inductions can take a long time. You get the idea. It's like, I'm tired of reading them because it's the same thing over and over again, okay? And so when you're setting realistic expectations, especially if you're looking at an induction, expect it to take time and know that that is normal. Thanks everyone for spending your time with me here. I really hope that you took some nuggets from this. I think that there's so much, I know that there's so much wisdom in our nurses, and understand that there is wisdom coming into your birth room by your nurse that they carry from every single birth they've ever witnessed. For me, that's over 5,000 births that you get as I'm here teaching you and bringing this knowledge to you, that you get to experience and kind of incorporate into your experience. Your experience will be your own. Your nurses are on your team. Understand what to expect for inductions, for pain management, for all the things going into labor. Take your childbirth class. I'll link ours down below. Prep your mind. Believe the best in those around you, and then if you are induced, expect it to take a long time. If you have other tips, please drop them in the comments down below. How did you see these maybe play out? What was your experience with your nurses, especially now that I sort of took a hiatus from YouTube and really focused on nurses? I would love to hear your stories that are more recent about the nurses that you're experiencing in the hospital, maybe from baby 1 to baby 2, because this community is being grown. They have owned their care. They are focused on you. They are pausing at the door prior to coming in and saying, I'm gonna give my best to this patient. I wanna offer them autonomy over their body and their decisions. I wanna listen to them when they tell me their concerns. I want to help down-regulate their nervous system and really support them to having the experience that you want, which is ideally one of the happiest days of your life. So let me know your stories down below in the comment box. Make sure you subscribe so you never miss a future video, including part 2, because I'm coming back with part 2 for some sneaky little tips from our labor and delivery nurses, and then I'll explain sort of my take on some of them, what they mean, and help translate that for you. And then, until next time, don't forget to flex and flow, and I will see you so soon. Bye. We're gonna have so much fun with this one. That's what contour can do.